Thank you all. I am going to just kind of maybe refer to my notes a little bit because it's been a while since I've done the talk, but here goes, and thank you for coming and listening to my story. I started in the NHS as a career changer. Actually, before I worked in the NHS, I was a chef. So I started as an auxiliary nurse in UHB, trust down the road, and loved working with patients and loved the role, but wanted to look outside to see what I could do to develop myself and go that little bit further. And I found a therapy assistant job here at the Dudley Group. Came, loved it, didn't really know much about therapy much before that role started, but absolutely loved learning about working with physios, occupational therapists, and delivering rehab to our patients. Again, I wanted to look to see how I could develop and grow and progress in my career, but going to university really wasn't an option for me. I got a small young family, commitments at home, and that wasn't something that was right for me at that time. But truthfully, I felt cheated, and I felt really I'd got this disadvantage because I was working with these registered clinicians that had got this opportunity to make a difference. They've got an opportunity to change things, and have got an advantage over me as an unregistered clinician that I hadn't got that same opportunity as them. So I looked to see what development I could do to develop and grow and contribute to my career and make a difference. So I looked outside the organisation, and as I grew my career, I progressed to a Band 4 assistant therapy practitioner, and I wanted to join the governing body of the Chartered Society of Physiotherapy for multiple reasons. Part of it was because it was a union, but also there was the professional side of that society that I wanted to see what opportunities were there for me to develop. And that was one of the best things that I ever did in my career, because it gave me a wealth of opportunities, and it gave me networking. I had coaching, I gained a mentor, I had some influence in training, and actually I was able to build a network. So I got opportunities within that organisation that I could influence, learn and grow. So I joined one of the committees of their annual conference, and actually was part of a review of that annual representative conference. I learned so much in that time that I brought all those skills back to the organisation and my team as well, so it was benefiting my department, my patients, and I was developing and growing. And part of my work with the CSP, I wanted to really influence, so we, through Members' Voice, knew that our international recruits that come to this country, they're really at a disadvantage. And this year I spoke on a motion to ask the CSP to consider giving free membership to our international recruits when they come to this country, as they do for our students actually. So they do it for our internal physiotherapy students, but not for our new international recruits. And we know the barriers that they face when they join this country as our workforce. So I'm using my skills to influence the governing body as well. We're still waiting on an outcome for that, but we should know in September, at the end of September of this year, whether that motion is going to be carried. And I'm really excited to see if that isn't taken forward. But throughout this time I was nurtured, I was developed to grow. So my success today, I'm now a lead AHP support worker for the Dudley Group, and I'm actually the system lead for the Black Country ICS 2 days a week. I now co-chair the West Midlands Regional Network alongside one of my colleagues, and I'm part of a national steering group for the AHP Support Workforce Programme. I don't like talking about this bit because it feels like I'm really bragging, but I'm really passionate about demonstrating and showing that support workers can influence, we can contribute, and we can make a difference. So since October last year, I've won 3 awards. So I won Black Country AHP Support Worker of the Year through the ICS, and Health Education England actually gave me an Outstanding Leadership Award in December of 2022. And in April of this year, I was awarded an Outstanding Contribution of an AHP Support Worker at the Advancing Healthcare Awards. I can't tell you what that means to me without getting emotional, because it means that my work does matter, and actually the work of support workers matter, which is more important, because I want them to understand that the care that we deliver is important and it's valued and it's recognised. Why is it important? Why is it important for me to talk to you today about that? Well, the Cavendish Review in 2013 was clear about the barriers support workers face, their training and their development. 10 years on, we still face those same barriers to access continued professional development. And that voice is actually national and regional, it's not just here in Dudley. A third of our workforce are unregistered, and they deliver hands-on care to our patients every single day. But yet they tell us that they haven't got time to be released. They are the most important part of our workforce that deliver direct patient clinical care, and we haven't got time to release them other than formal learning or mandatory training. They're the backbone of this workforce, but they've got no time to be released. So Professor Richard Griffin, he's wrote a book on healthcare support workers and their development. He's researched and he's actually a professor at the King's College in London, and he contacted me through my networking to ask me to contribute to this book about being a lead AHP support worker and what leadership matters to support workers. So I was really delighted to be able to have my thoughts and my vision for support workers and the leadership of it put into this book. I want to be able to support and empower support workers to understand that leadership is not about a banding, it's not about a title. This is about the roles and the teams that we work in, and we are all leaders and we can all contribute to patient care and make a difference, and we all should be allowed the time to develop and grow and not just formal learning. We shouldn't be bound by titles or banding, and we should all have the same equal opportunities, but also we need to empower our support workers to access that as well. So what have I done? So as my role as lead AHP support worker, I've gone out to support workers and asked them what their gap is, where their skills that they want to develop, and what is it that they want to be able to do within their roles. And actually they told us that they are the glue to their team. They're the people that are there often the longest, and they support their teams to go through change. They support their teams when there's somebody off sick because they know that team inside out. But actually they'd like some communication skills, they'd like some opportunities to be part of quality improvement, they'd like the opportunity to be able to have a difficult conversation with somebody, because often there's some things that they haven't had that training in. So I worked with the OD team here in the Trust, and I've worked with Dudley College, and we've created a course, the Higher Development Award. We've managed to get free funding from the West Midlands Combined Authority, and we've got 6 cohorts of a level 2 and a level 3 programme for, the initial brief was for AHP support workers, but I've widened that now and we've opened it up to anybody in a non-registered role. So that is for our admin staff, our clinical support workers, or an AHP support worker. I want them to be able to develop and grow within their role, to be the best support worker that they can be. And already we're getting really good feedback from support workers that are currently on their first cohort. So today, my call to action for you all is, what are we doing for the third of the workforce in our teams to develop and grow? What can we do to support that support worker to be the best support worker that they can be?